Welcome to Resolve IBS and IBD Naturally. I'm Courtney Cowie, a nutrition therapy and functional diagnostic nutrition practitioner. If you are struggling with the symptoms of IBS or IBD and want to get to the root cause of your symptoms so you can take back your health through a whole person approach, this podcast is for you. Just a disclaimer that the information I'm presenting in this podcast is for educational purposes only and should not be taken as medical advice. You should always consult a qualified practitioner before making any changes to your health or medical regimen. That being said, let's get on with the show. All right, so I'm super excited to have my friend and colleague back, Abby Vallejo. She's here with me today. We're going to talk about thyroid, all things thyroid when it comes to hormones, when it comes to gut, and just kind of a really nice overview on the function of the thyroid, how it works, and why it's important if you're struggling with chronic illness. So, Abby, let's kind of dive into just the symptoms of low thyroid, because I think that's a good place to start. A lot of people probably are having several of these symptoms and might not even realize that their thyroid might be a piece of their health puzzle, right?
Yeah, absolutely. I think this is such a relevant conversation because thyroid is, especially for women, is something that affects women and, is often underdiagnosed. Like how many women are walking around with clear thyroid symptoms and they don't know it, right? So, yes,
Yeah.
let's dive into that. So, fatigue is a big one. So, if you're walking around, you have a lot of fatigue. Weight gain. So if you're having trouble losing weight or you're putting on the weight and you're just feeling like it's not coming off no matter what you're doing, thyroid might be a piece of the puzzle if you have low thyroid function because your thyroid is intricately linked to your metabolism. And so if your thyroid is not functioning optimally, neither will your metabolism be.
Mm-hmm.
Cold intolerance is another really big one. So are you cold all the time? Even when you shouldn't be cold, even when no one else is cold? Or do you just get so cold you always need like an extra layer? It could be a thyroid issue.
Mm-hmm.
Another one is dryness. So if you have like really chronically dry skin, dry hair, dry eyes, it's just like this picture of dryness is often a common low thyroid function issue. Another thing too is going kind of zooming in on the hair a little bit. You can usually tell when someone has a low thyroid issue going on because they kind of just have this particular look with their hair and their eyebrows. So the hair tends to be like very, very sparse. It's often brittle. Usually these people have short hair because it tends to really break off. I feel like most of the clients that I see that really suffer with this before we, get it rebalanced, it just kind of has this like wispy kind of windswept look where their hair just kind of like brittles away into nothing because it just breaks off. And then if you look at the outer third of the eyebrow, often that's completely missing. The eyebrows get really thin and then that outer third can be missing. So that's a very common, like if they look dry, they're missing that outer third of the eyebrows and their hair is just really brittle and thin and wispy. That's kind of a dead giveaway to low thyroid function. Another big one can be mood. So, if you're dealing with something like depression or low mood, the thyroid is intricately linked to that as well. And so that is a common one that we see. And that, often, women will go in and they'll be dealing with depression and the doctor will be like, great, here's an antidepressant, rather than, oh, should we check your thyroid? Should we check your hormones and see what's the underlying driving factor as to why this is happening? Right. Constipation is another big one. So if you have sluggish digestion and poor gut motility, basically meaning that it takes a long time for food to get through your system, leading to something like constipation because you just have a backup going on, that is a common symptom of low thyroid function. Brain fog is another one. So
Mm.
if you're just like, basically it's an overall picture of sluggishness in the body and the brain is
Mm.
included in that. So if you're like having trouble remembering things, the cognition is kind of slow, that brain fog, that can be related to thyroid as well. A slow heart rate is another one. Aches or muscle weaknesses can be another thing that can happen. And then like a picture of puffiness, right? Because again, going back to
Yeah.
that stagnation, you're not getting like good drainage. And so you might have like a puffy face, just kind of an overall issue with like weight and puffiness. I think are the most common things that I see related to low thyroid function.
Yeah, that's such a great comprehensive list and definitely some things in there that I wouldn't necessarily remember right off the bat. So you did you did a good job going through
Thank
all that,
you.
Abby. Yeah, and I think just to kind of fill in a little bit, one of the common things I think I hear from a lot of my female clients